So the COVID-19 numbers, I know, feel numbing at times, but think about it this way. The number of COVID cases in the U.S. is equivalent to the entire population of the state of Illinois. The number of people who've died in the U.S. could fill the largest stadium in the country, what you see there, Michigan Stadium, almost 3 times. They're not just numbers, they're people. And COVID is ravaging the rural hospitals trying to save them.
Of people who just care about making sure that patients are taken care of. It's difficult because we're so small that we only have a handful of staff to pull from, really. If I lose or we lose 2 or 3 nurses or workers from other departments, that can quickly become 10 to 25% of the team in that department.
That's Sara Brokaw. She's the director of nursing at Bellevue Hospital in, transparently, I'm telling you, my hometown, Bellevue, Ohio. It's a sweet rural community. It mirrors thousands of rural districts in our country, and there's been a shift in the struggle. Sara told me the problem isn't PPE now, as it was in the spring. The problem today is the alarming rate at which this virus is spreading.
For us to go from where we would only have 2 or 3 potentially positive COVID patients in-house to now 75%, I can't begin to imagine what our frontline teams are feeling. I see it on their faces, and I see it in their tears.
Now, before COVID, gloves were standard protection, right? Add masks and eye protection now. And you heard her right. Yes, 75% of patients at Bellevue Hospital right now are there because they're COVID positive, which means the protective equipment is much more cumbersome.
Now they're wearing an N95 or a PAPR, which is a personal air purifying device, and they're wearing gowns, and they're wearing gloves, and they're wearing eye protection. And it's like getting dressed to go sledding every day for them. I mean, it's a lot.
Now, they do collaborate with other rural and higher capacity hospitals such as Toledo and Cleveland to avoid reaching a point where they can't take any more patients safely. But Sara says right now they're close to that point.
We have a limited number of staff that we can pull from, and staff can only cross-train to so many different places and be trained to do so many different roles. And it's an emotional thing for them. It's hard.
Sara says they have incredible support from the community and from the board, but there are still a lot of people who don't understand the severity of the situation, and that's one of their greatest concerns and really most dangerous obstacles to taking care of people.
In different things that I've read, one thing that I've always found interesting is the studies around how facts, once somebody has made their mind up about something or has a perception about something, that facts can't change their mind. That really the only thing that can change their mind is experience. And that's a scary thought, because we don't want people to have to experience this to be able to truly understand how significant this is.
I know that I've seen people who were questioning it, and then they got sick, and their mind did change. And we hope that that is not going to be the case for people who think that this isn't real or that this isn't problematic. Because at the end of the day, we have record numbers of people dying from this pandemic, and it's going to be up to us doing what we can to try to take some of the pressure off of those frontline responders, because they're doing everything they can.